Hello friends, in this video we are learning about insulin and hypoglycemic drugs. In the another word, it is also often known as anti-diabetic drugs that we are going to cover today. So for that, I have purposefully divided this video into two parts. In part 1, when we will go through only and only about insulin and its synthetic derivatives which are there in the market. And in the second part of it, we will go through tablets and capsules of anti-diabetic drugs. Alright, so the most interesting fact about diabetes is it is the topmost cause of natural death in human being after cancer and heart related disorder. Okay, so we will go through its definition first. So its definition states that diabetes, that is diabetes mellitus, represented as DM, is a metabolic disorder characterized by hyperglycemia, glycosuria, hyperlipemia, negative nitrogen balance, and sometimes ketonemia. So it is a kind of metabolic disorder where there is disruption in the metabolic pathways, and especially there is a rise in level of glucose that further lead to disruption of all those pathways. All right, so we will go through its classification first for this diabetes. Actually, these diabetes are of two types. We will go one by one. Type 1 and type 2. Type 1 in diabetes is also known as insulin dependent diabetes mellitus, where the insulin administration is must. There is no insulin at all in the body. In case of type 2, there is maturity onset diabetes mellitus, where we can say there is an aging of pancreas and it loses its functionality to produce insulin. So as we all know that pancreas has islet of Langerhans, where it has three kinds of cell: alpha, beta and gamma cells. Here we will particularly emphasize or focus on these beta cells only. All of these cells has their own function to perform. But in case of type 1 diabetes, what exactly happens? Let's see. There is a beta cell destruction in pancreatic islet, majority of cases due to autoimmune antibodies. So in case of type 1, there is disruption of beta cell. But in case of type 2, there is no loss or reduction in beta cell mass. Indeed, pancreas decreases its functionality to produce adequate insulin, as I already mentioned. So in type 1, pancreas has got destroyed. Like that we can remember, means beta cell got destroyed. But in case of type 2, there is disruption or reduction in the functionality to produce adequate insulin. So type 1 is less common and genetic disposition is very less. But in case of type 2, it is the most common diabetes that is currently seen in the different patients. Alright, so let us go through its characteristic of insulin. So as we all know that insulin is nothing but a protein because it has a long chain of amino acid. So it can be seen through this picture that I have taken from K.D. Tripathi book. It has two chains, A chain and chain B, which has 51 amino acid in total. A chain has 21 while B chain has 30 amino acids. 21 and 30 amino acid, total 51. Furthermore, we will go through its other characteristic. Its regulation is done by glucagon that is secreted by alpha cells, and that is inversely proportional to insulin. As insulin level increases, glucagon level decreases, and vice versa. And also it is regulated by somatostatin that inhibits both. When there is secretion of somatostatin, glucagon and insulin both will get suppressed down, and it can be seen through this picture that is also from K.D. Tripathi. Third point, previously pork and beef were used to extract the insulin. There are only minor differences between human, pork and beef insulins. These days we use humanized insulin with the help of technology called rDNA technology, through which we can produce such kind of humanized and more personalized kind of insulin. Also, it facilitates glucose to skeletal muscle and fat cell. So what does insulin do? It facilitates or transport the insulin to skeletal muscle and the fat cell for its proper utility in the body instead of storing it for different purposes. What's more, it increases utility of glucose. However, glucose entry in liver, brain, kidney, RBC, WBC is largely independent of insulin. So for this vital organ, there is not dependency towards insulin for liver, brain, kidney and RBC WBC. Besides, insulin facilitates glycogen synthesis from glucose in liver, muscle and fat cell. So we can say it utilizes the glucose for the synthesis of glycogen. That's how it maintains the body weight. And the last one more point is there. It inhibits gluconeogenesis in the liver. So it inhibits gluconeogenesis. That is nothing but synthesis of new glucose inside a liver. So it has function towards liver, that is it inhibits gluconeogenesis and promotes facilitates the production of glycogen. It gives the glucose to fat cell and skeletal muscle for the proper utility and distribution in the body cells, and that's how it maintains the body weight. That is the purpose of insulin, and that is the purpose of pancreatic cells. So now we will go through the classifications of insulin preparation that are there in the market. Actually there are 4 classes. We will go one by one. First class is short acting, that is nothing but our regular insulin. Second is intermediate acting, insulin zinc suspension, or it is also known as Lante. Third is long acting, which has long action. Example is insulin glargine large action, long acting. That's how we can remember. And fourth one is rapid acting insulin. It is insulin lispro and insulin aspart. Its name itself represents lispro, that is pro in their action. That's how we can remember this also. And for short acting the duration is 6 to 8 hours. For intermediate acting duration is 20 to 24 hours. For long acting 24 to 36 hours. That's how it can be taken once in a day, long acting insulin. And rapid acting, its onset is 20 to 40 minutes, but the duration is only 3 to 5 hours. So it has to be taken twice, thrice, 4 times a day, like that. So how this kind of synthetic versions are derived actually? So we know that insulin is a hexameric structure actually. So to have the action of insulin inside our body, first it has to get dissociated into its monomeric form. For that, in rapid acting insulin, what does scientists do? They have developed insulin lispro and insulin aspart such that they are already in monophasic form, in monomeric form, and it can be distributed throughout the body. And in opposite to that, in case of long acting, we use this hexameric form of insulin only, but with that we attach zinc or other fatty substances to it so that their dissociation get reduced or shortened down. The last part of this video, we will go through the features of these brands which we have discussed now, or synthetic versions. Not brands, synthetic versions. Insulin lispro, insulin aspart and insulin glargine. First two are rapid acting and the last one glargine long, that is long acting. Okay, so insulin lispro we will discuss now first. So it is produced by reversing proline and lysine in the chain, that is amino acid, they got reverse out. So that's why we get quick and defined peak, and but the duration is shorter. In case of aspart, insulin aspart, proline is replaced by aspartic acid. So it is here it is the replacement, there it was reversing. This change reduces the tendency of self-aggregation. Self-aggregation of what? Hexameric structure of this insulin. That's why there is rapid acting. Insulin glargine. It has 2 additional arginine residues at the end of B chain, and glycine replaces asparagine at A chain. So there is changes in beta chain and B chain and A chain. So that's why we got smooth peakless effect, and it is taken once in a day because it is long acting and there is no peak. Smooth peakless effect we obtained. Let us have a look on the brand images as well. The first one, insulin lispro, its brand name that is there in the Indian market is Humalong. Second is insulin aspart, the brand which is there in the Indian market is Novorapid 100 IU, like that. And the last one is, let us have a look, it is a Lantus and of insulin glargine. Alright, so almost we have covered everything about insulin in this video. So thank you for watching this video. In the next upcoming video, we will certainly go through its tablet and capsules of anti-diabetic drugs. Thank you so much.